For joining us on a busy Thursday. I'm Siobhan Bryan with your news at 6.
And I'm Daryl Green, and for John Carter. Tonight, WBTV is digging deeper into a Medicaid program that led to a massive FBI raid across Charlotte late last year.
In October, federal agents seized evidence from properties owned by Charlotte activist Cedric Dean. Now, no criminal charges have been filed against Dean, but the warrant written by the FBI claims Dean and his company were allegedly committing health care fraud. Investigative reporter David Hodges wanted to find out why the company didn't set off alarms earlier if it was allegedly billing for millions of dollars in fraudulent claims.
Davis joins us now live in studio with a story you'll see only on WBTV. So, David, what sparked your investigation?
Yeah, Daryl, for me, what stood out is that Cedric Dean is not a doctor. He's a convicted felon turned community activist with little to no medical training, but court records claim that Dean and his company falsely billed Medicaid for millions of dollars. And I wanted to find out how.
The FBI today seen raiding 3 Charlotte properties as part of a massive healthcare fraud investigation.
FBI agents swarmed properties owned by Cedric Dean and Cedric Dean Holdings last October as part of a vast investigation into healthcare fraud. In court filings, federal agents claim Dean's company billed more than $14.5 million, with almost $9 million of that paid out to Dean's company in just over 10 months. They allege he used the money to buy property, cars, and several RVs. But how was Dean, someone who spent 23 years in federal prison for selling drugs, able to bill Medicaid in the first place?
We get these kids to see each other as human beings and not animals.
How did he go from running after-school programs like this in 2018 to allegedly making more than $5,000 per week and buying a $1 million home that he called Thug Mansion? Court records in WBTV's investigation revealed Dean and others in his company, like former Charlotte City Council member Tijuana Brown, were licensed certified peer support specialists.
I think there are certain programs that unintentionally are probably set up for waste and fraudulent activity.
State Representative Grant Campbell is a physician and sits on the Joint Oversight Committee for Health and Human Services. I spoke with him about his concerns over the peer support specialist system in North Carolina.
So if I want to start a program that's going to improve public health and help people with homelessness and substance abuse, I don't want to subsidize someone to buy their third house and a luxury car. That's not what it's there for.
On its website, the North Carolina Department of Health and Human Services claims that certified peer support specialists are highly trained individuals with lived experience who can help people with mental health and substance recovery.
Boom. You are officially a North Carolina certified peer support specialist.
Becoming a CPSS in North Carolina requires 80 hours of training and 18 months of recovery. Those requirements are far less intensive than other professions that can bill Medicaid, such as doctors, nurses, or chiropractors.
There is a role for this, but there's a trap here. I call it the trap of good intentions, or reverting to good intentions, as you pass a policy that has good intentions, but you're not doing proper oversight and it's being abused.
WBTV filed a records request with NCDHHS to find out just how much oversight there is. The agency sent us this spreadsheet. The list shows how many complaints have been filed against peer support specialists. However, the agency is refusing to tell us what's on those complaints or give us records of disciplinary actions taken against peer support specialists, claiming that those records are confidential. However, disciplinary actions for doctors, nurses, and other medical professionals are typically considered public record.
The best way to stop fraud is to prevent fraud.
Campbell sent his own questions about the CPSS program, but said the answers from state health leaders were lacking. Is that a situation in which some of those guardrails need to be reviewed?
Yes, they need to be reviewed, and sometimes we need to find guardrails to be in place at all. The message that I give folks with these programs is you can answer my phone calls and my emails, or you can be sworn in an oversight committee, but one way or the other, I'm getting these answers. You can decide what the venue is.
And that is exactly what happened. This month, Representative Campbell chaired a hearing on Medicaid fraud, and he asked DHHS Secretary Dr. Dev Sangvi specifically about fraud and abuse in the peer support system. Here's how that conversation went.